Hello, welcome to my channel. My name is Pauline RN. Today we are on part 3. We will be talking about safety, environmental hazards, injuries, accidents. We will be doing questions and answers from RN Nclex examinations. Please hit the thumbs up, please subscribe, please share this channel with your classmates. My first question is, older adults are at risk for what? The correct answer, older adults are at risk for falls, fires, motor vehicle accidents is the correct answer. Next question. What are the risks of adolescent? What are the risks of adolescence? The correct answer, when we're teaching them, we should focus on education of safe driving skills. Our education should focus on dangers of drugs, alcohol use. The next question is, carbon dioxide fire extinguishers should be used to extinguish what? The correct answer, carbon dioxide fire extinguishers should be used to extinguish water is the correct answer. Children is most vulnerable to what? Children is most vulnerable to what? The correct answer is poisoning. Next question. More than 1/3 falls in the elderly is associated with what? And the correct answer is the need to urinate is the correct answer. When we're talking about clients with a history of falling, client is admitted and the client told us, or the family member, this client has had history of frequent falls. What should we consider? The correct answer is clients with history of falling is at great risk for falling in the hospital, is at great risk for falling while they're in the hospital. We place them on fall prevention. We will make sure the call light is closed, the bed alarm is on, the chair alarm is on. These clients will always have standby ambulation. They do not walk by themselves. Next question. Most exposure to toxic fumes occurs where? And the correct answer, most exposure to toxic fumes occurs in the homes is the correct answer. Next question. Rear facing safety seats is recommended for infants who weighs how much? The correct answer, rear facing safety seats is recommended for infants who weighs less than 20 pounds is the correct answer. What is the major safety problem in healthcare facilities? The correct answer is false. The major safety problem in healthcare facilities is false. Next question. When you're filing an incident report, for example, maybe your patient fell, what should the nurse be aware of? The correct answer: when you complete your incident report, do not document that an incident report was filed in your nurse's notes. Do not document that an incident report was filed in your nursing note. The incident report is not a part of the medical report, should not be mentioned in documentation is the correct answer. What are some safety risks for adults? The correct answer is spousal abuse, using alcohol to relieve stress are safety risks for adults. What are safety risks for older adults? The correct answer: motor impairments, 1, 2, elder abuse, 2. These are risks for older adults. When they come into the ED, do a complete assessment for elder abuse and report as needed by your facility. Next question. What are your limitations for older clients? The limitation for your older clients are mobility, unsteady gait. These clients are all risk for falls, recent surgery, prolonged illness. These are your correct answers. Excuse me. Name some sensory perception limitations in your patients. What are your sensory perception limitations? The correct answer: visual changes. Patient is at risk for falling. Patient will lose balance. Patients have hearing difficulty. Patients lose their ability to communicate. Patients are insensitive to alarms. Example: horns, telephones ringing. Make sure these patients, you lower your telephones at nighttime or turn them off. Muscle impairment. Some of these patients have histories of stroke. Visual impairment. For the elderly with visual impairment, they are at risk for poisoning. What are your limitations in clients' inability to communicate? What are limitations in ability to communicate in clients? The correct answer: Clients are not able to communicate due to fatigue, due to stress, aphasia, language barrier. They'll need an interpreter. Patient unable to express safety concerns. These are all your limitations in communications. These are the correct answer. Next question. What are your psychosocial limitation states in your patients? And the correct answer, your psychosocial limitations are, correct answer, depression, confusion, disorientation, decreased environmental hazards in these patients. They are not aware. These patients with psychosocial limitation is also due to social isolation. Patients who maybe who has an infectious disease, patients who are socially isolated, maybe they are in the ICU. These clients have psychosocial limitation. They also have social isolation with reduced concentration. These are all your limitations. These are all your correct answers. When your patient is admitted, question, what should the nurses check for safety? The correct answer, check if these patients are using assistive devices, walker, cane, wheelchairs at home. Nurses should check for history of alcohol abuse at home. Nurses should check for history of recent falls at home. These are a part of your nursing history. These are gathered from your patients on admission. Please hit the like button, thumbs up, please subscribe, and please share this video with your classmates. This is part 2 to safety, environmental hazards, injuries, accidents. Thanks for watching today. Have a good day.